Hi everyone, hope you're all doing good. In this video, we're going to discuss about perineal lacerations. Perineal lacerations. See, in most of the cases during childbirth, women are going to have perineal lacerations, okay? But in 50% of the cases, these can be extensive also. Clear? So, now we'll see what are the causes of perineal lacerations. Causes of perineal lacerations can be classified as maternal causes and fetal causes. First, let us discuss about the maternal causes. In a case of precipitous labor. So, what is this precipitous labor? Precipitous labor is a labor in which the woman delivers the baby very fastly, that is within 30 minutes after onset of regular uterine contractions. Okay? Or if there is fundal pressure given during labor, there is edema and friability of the perineum, vulvar varicosities are present, that is weakening the tissue, and sometimes it can happen due to an episiotomy extension as well. Okay. Then let us see the fetal causes. We know when there is a large baby, there is a more chance for perineal lacerations. Then when there are abnormal presentations like occipito-posterior position or face presentation. Also in case of breech presentation, or there is difficult forceps extractions encountered, or when there is shoulder dystocia, and maybe due to any other congenital anomalies as well. Okay. So, these are the conditions where we can expect perineal lacerations. Now, let us discuss about the classification of perineal tears. So, classification consists of 4 degrees of perineal tears. So, the first degree is when there is superficial injury, okay, that is involving the vaginal mucosa, okay, but it may also involve the perineal skin as well. And the second degree of perineal laceration is where, so it involves the vaginal mucosa as well as the perineal skin. Along with it, it includes the perineal body as well. Okay, perineal body and the perineal muscles. And then third degree is when there is involvement of, yes, the vaginal mucosa is involved, perineal skin is involved, then the perineal body and the muscles are involved. Now, there is involvement of the sphincters as well, especially the anal sphincters. Okay. So, third degree is further classified into 3A, 3B and 3C. In 3A and 3B, external anal sphincter involvement is seen. In 3A, it is less than 50%, whereas in 3B, it is more than 50%. Whereas in 3C, both internal anal sphincter and external anal sphincter tear are seen, right? Now, coming to the fourth degree of perineal tear, there is involvement of the rectal mucosa as well. Okay. So, this third and fourth degree perineal tears, okay, so that is involving severe perineal lacerations or classified as voyages. Okay. So, what does voyages means? It is obstetric anal sphincter injuries. Okay. Now, if we see, nearly 50 to 90% of the women experience from some form of the perineal tears, and among them nearly 60 to 70% of the women are going to repair suturing, right? And among this, voyages is going to contribute to about 4 to 11% of the perineal tears. right? Okay. Now we will see how we are going to repair perineal tear. So first let us see the prerequisites. We should have a good light source. There should be adequate tissue exposure. We have to give appropriate anesthesia. We should have proper suture materials. Then other instruments like needles, scissors, etc. Okay. So step by step we will see how we are going to repair perineal tear. So first one, you have to examine the perineum and vagina and cervix for any tears, right? And then you have to perform a digital rectal examination as well, okay, so that you can assess the tone of the sphincter and whether it is having integrity or not. Clear? Suppose if you have a first degree perineal tear, that is hemostatic, then you have to check whether if there is repeating again. Suppose if you have a first degree perineal tear in which the hemostasis is also secured, remember this need not be repaired because there will be no much distortion of the anatomy, right? And suppose if you have second degree lacerations, you have to do a continuous or running suture rather than interrupted sutures. Because why? Because there will be less postpartum pain with continuous or running sutures, as well as you have to remember that the approximation of these sutures should be done up to the level of hymen. Okay. If there is a need, you should even repair the perineal body and the submucosal region. Finally, you have to do skin suturing as well. Clear? Right. Now, we will see about the third and fourth degree lacerations. You have to do a stepwise repair here. Okay. First, you will be repairing the rectal mucosa. Okay. And remember, you should not penetrate the rectal mucosa. Okay. And following this, you have to approximate the anal sphincters. Okay. While repairing anal sphincters, remember internal anal sphincter repair should be followed by the external anal sphincter, right? And this will be followed by the repair of the skin. Okay. So, we have repaired the third and fourth degree perineal tears as well, right? Now, post repair management is also important in a case of perineal tear. You have to give antibiotic like a single dose of second generation cephalosporin. Okay. So, that will be reducing the risk of infection as well as it reduces the chance of wound breakdown also. Okay. Then you have to do pain management, that is you have to give analgesics. You have to put the patient on laxatives or stool softeners as well to avoid constipation. Yes. And finally, don't ever forget to monitor for urine retention as well. Clear? Right. Now, We'll see what are the complications that can be expected in a case of perineal tear. There can be bleeding or hematoma, pain can be there, infection can be there. If there is infection, that is going to delay bleeding. Wound breakdown can be there. Urinary or anal incontinence can also happen. There can be dyspareunia, or sometimes there can be chances of rectovaginal or rectoperineal fistulas as well. Okay, so this can be unidentified or poorly repaired also, especially in case of VIASS injury. Clear? Yes. Now, how we can prevent? So, prevention of perineal tears can be done by perineal massage. Okay. However, the reduction in incidence of perineal lacerations was very minimal reduction. However, it promotes perineal relaxation, increases blood flow, and it helps in stretching up of the perineum prior to delivery. Okay, they say perineal massage can be started right from 34 weeks till delivery. Clear? Yes. And second option is you can give perineal support during delivery. So, that is also known as hands-on approach. Okay. So, this will decrease the severity of perineal lacerations. And then we can even give warm compress during second stage of labor. That will decrease the VIASS injuries. Clear? Right. Now, remember, you have to give counseling for the women. Suppose if there is VIASS injury in previous pregnancy, women should be counseled about the risk of recurrence of VIASS injuries in the current pregnancy. Suppose there is history of VIASS injury and the patient is also asymptomatic and there is no symptoms of sphincter injury as well, then you can permit them for normal vaginal delivery. Clear? So, with this we will be finishing this topic about perineal lacerations. Until we meet in the next topic, take care, happy learning and bye-bye.